Hello and welcome to the Natural Sciatica Relief System. My name is Pat Kilcherman and I'm the co-founder of the Sciatica Institute. And on this DVD, I'll be helping you begin the pain relief process by showing you exactly what causes sciatica and helping you to pinpoint the source of your own pain. Now, one of the biggest problems with taking your back pain to a doctor, chiropractor, or even most physical therapists is that they treat their knowledge of the human body as almost a sort of a trade secret. They would prefer that the patients concentrate on simply passively receiving their treatment and eventually paying their bill. But the truth of the matter is that most people who suffer from sciatica can learn to eliminate their pain and eventually correct the cause of sciatica at its source to ensure that it never returns. Now, we take your health seriously, and you should too, so give yourself the time necessary to heal, and please be patient. If you do not experience this program in the order in which it's presented, we can't guarantee that you'll see the results that you desire. So make the choice right now to give your body the attention it needs by learning how to stop sciatica at its source. What is sciatica? It's absolutely critical to your success with the Natural Sciatica Relief System that you know a bit about what sciatica is and where it comes from. The word sciatica itself is not the name of a disease or disorder, but it's a description of any pain that arises from the irritation of the sciatic nerve. This means that sciatica is actually a symptom, the result of a dysfunction, rather than a disease in itself. This means that we have to go deeper to find the cause of the pain if we wish to eliminate it. The sciatic nerves are the largest in the human body, and they run from the lower back through the buttocks, down the thigh and calf, all the way down to the Achilles tendon. The size and the length of these nerves make them vulnerable to a multitude of injuries and irritations. There are basically 4 primary physical disorders that cause sciatic pain, and in just a few minutes, you'll be able to identify which of these problems is the likely cause of your back pain. This knowledge is the foundation of the Natural Sciatica Relief System, and understanding the mechanical problems that are causing your pain is going to make your efforts exponentially more successful. However, there is a crucial concept that we need to discuss before we go any farther. Because not only are we confident that the vast majority of sciatica sufferers can eliminate their pain and prevent it from reoccurring without medical intervention, and not only do we know that we can help you identify which of the common causes of sciatic pain that you suffer from, but we also know that almost 100% of back pain, including the 4 disorders that we're about to cover, have a single common cause. Introduction to muscle imbalances. Unless you are part of the small minority of back pain sufferers whose condition is genetic, I can almost guarantee that over time, your pain can be eliminated, provided that you treat the muscle imbalances that actually cause disc herniation, muscle spasms, and poor posture, all of which ultimately put pressure on the sciatic nerve. Even if your condition is genetic or your back pain is the result of an injury, correcting your muscle imbalances is the best way to relieve your pain naturally at home without exposing yourself to the dangers of invasive surgery or the negative side effects of drugs. Now, there are over 640 muscles in the human body, and many of the muscle groups that we use to perform our most common daily tasks like walking, running, sitting, standing, or driving are anchored to or directly affect the position of your spine and pelvis. Every time you move, one set of muscles contracts while the opposing set of muscles relaxes. An imbalance occurs when these paired sets of muscles are less than equally strong and equally flexible. The result is a constant pull on your body's central scaffolding, your bone structure. And once you identify and correct your muscle imbalances with our help, not only will you eliminate your back pain, but you'll also simultaneously improve your posture and make yourself less prone to future leg and back injury. We all have these imbalances, and they aren't a matter of physical fitness. In fact, most common exercises, including running, cycling, and playing team sports, create or exacerbate muscle imbalances. Everyone, from a relatively sedentary office worker to a marathon runner, has these imbalances, and sooner or later they will result in pain and injury. And because you've created your imbalances over the course of months and years, you should know that it will take time to correct them. So be patient and know that once you have diagnosed the immediate source of your sciatic pain and relieved that pain using the second volume of this program, you will need to stick to the program that will help you create in the third volume to correct your muscle imbalances. The 4 sources of sciatic pain. Before we go any farther, you should know that if your back pain is extreme, that is, if you have lost control of your bladder or bowels, or if you have severe muscular weakness in both legs simultaneously, you should consult a physician immediately, as you may have a serious condition. You should also know that if you're pregnant or have had a total hip replacement, or if you have previously had back surgery, you should consult a physician before beginning any new exercise or stretching regimen. Remember to tell your doctor very specifically that you are interested in relieving your discomfort by correcting muscle imbalances using exercise and stretching. If they are unwilling to respect your wishes in this matter, they may not be the right physician for you. Because pregnant women should avoid both prescribed and over-the-counter medications completely, rest and mild exercise may be their best sources of relief. The pregnancy hormone relaxin loosens joints and ligaments throughout the body, and identifying and treating muscle imbalances will be made more difficult by these natural alterations to your body. You will be best able to correct pregnancy-related back pain by doing preventative exercise and stretching to bring your muscles into balance before and after pregnancy. Now, regardless of how much weight you gain during pregnancy, the distribution of that weight will work some muscles more than others, creating an imbalance which you need to correct postpartum. Alright, let's begin to talk about the 4 common conditions that result in sciatic pain. First, we'll review what happens in the body of someone experiencing each condition, and then we'll circle back around to guide you through some exercises to identify whether or not these conditions may be behind your pain. You should know that you do not need to be previously diagnosed in order to benefit from this program. Simply listen closely, perhaps take some notes, and more often than not, you'll find that you strongly identify with one of the symptoms of the following 4 conditions. What is piriformis syndrome? Let's begin with the most common condition which causes sciatic pain, piriformis syndrome. Your piriformis muscle is a sort of pear-shaped muscle of the gluteal region of the upper leg. It originates at the sacrum, the large triangular bone at the base of the spine, and just above the hip on the pelvis. From there, the muscle stretches through what's called the greater sciatic foramen, one of the natural openings in your pelvis, and finally attaches to the femur. The piriformis is involved in laterally rotating your hip. To get an idea of where this muscle is, you can put your legs into a sort of figure 4. Your piriformis is the muscle used to pull your knee downward. This is the muscle that is kept almost perpetually tense when you sit down at your desk and allow your legs to flop outward. This overused muscle directly crosses and frequently irritates the sciatic nerve, and even a person without piriformis syndrome who sits for extended periods of time each day will develop a serious muscle imbalance on account of a perpetually contracted piriformis. However, for almost 1 out of 5 people and a significant portion of sciatica sufferers, there is an additional complication which causes this muscle imbalance to manifest itself as pain or numbness in one or both legs. For most people, the sciatic nerve weaves under the piriformis muscle. However, approximately 17% of the population has a sciatic nerve which goes over, or more commonly through, the piriformis on its winding path down the thigh. This slight abnormality can make irritation of the sciatic nerve more likely. However, all sciatic pain originating from the piriformis muscle and manifesting as pain or numbness, which begins in the buttock and radiates down the leg, is generally classified as piriformis syndrome. Again, this is a purely muscular issue, so even if you've been told that the structure of your body lends itself to experiencing piriformis syndrome, you will soon have the opportunity to alter the structure of your lifestyle to correct this issue and eliminate the pain. What is a bulging or herniated disc? The next most common cause of sciatic pain is a bulging or herniated disc. It's important to know that many people, including doctors, use a number of different confusing terms when talking about damage to the fibrous discs between our vertebrae and the role they play in causing back pain. Despite the variety of vocabulary used, a bulging, a prolapsed, herniated, ruptured, torn, slipped, or protruded disc, and even a thrown out back are all basically the same thing: damage to the intervertebral disc. When this damage causes the fibrous outer wall of the disc to buckle, we refer to it as protruding or bulging. But when that wall actually tears, we refer to the condition as a herniated, prolapsed, or slipped disc. In both situations, pressure is being put on the surrounding nerves by the bulged wall of the disc or the leaked gelatinous fluid. The result is a lingering, easily aggravated pain most commonly found in the lower back. If your pain came upon you suddenly after an unusual strain like lifting a heavy object or shoveling snow or even sneezing, it's possible that your sciatic nerve is being irritated by a bulged or herniated disc. You can solve this problem without surgery. You can live without pain provided that you persevere and correct the problem. Surgery corrects the symptom for a time, but the true underlying cause, a muscle imbalance, is still working against you and will almost inevitably lead to further incidents if you choose surgery or bed rest over exercise and stretching. When a disc has been damaged, it is always slow to heal due to low blood flow in this region, which means that it could take months for your pain to go away on its own. And then you'll still have the same muscle imbalances which led to the unusual strain being put on your disc in the first place. Exercise and stretching are going to correct your muscle imbalance while increasing the blood supply to the injured disc, so you'll be on your feet faster and you'll be less likely to experience a similar injury in the future. What is spinal stenosis? The final two conditions we need to talk about occur far less frequently than piriformis syndrome or a bulging or herniated disc. While a significant portion of the population will experience both disc injury and sciatic pain due to muscle strain in their lifetime, spinal stenosis and spondylolisthesis are much less common. Spinal stenosis is an abnormal narrowing of the spinal canal, which puts pressure on the spinal cord itself and the nerve roots as they exit the spinal column. When this happens in the lumbar vertebrae in the lower part of your back, the pressure on the nerves manifests as pain, weakness, or numbness. Spinal stenosis also differs from the previous two conditions that we've discussed in that it's sometimes a congenital defect and also shows up much more frequently in people over the age of 50. Unlike a bulging or herniated disc, spinal stenosis is also likely to affect both sides of the body. However, much like both tension in the piriformis and damage to the intervertebral discs, the pain spinal stenosis causes can be greatly alleviated by addressing muscle imbalances with targeted stretches and exercises. Because of the nature of this disorder, the most common surgical solution involves removing a portion of the lumbar vertebrae. However, most people with spinal stenosis can eliminate their pain by correcting the muscle imbalances which have been exaggerating the natural curvature of their spines and putting additional strain on the spinal cord and surrounding nerves. What is spondylolisthesis? The final disorder which commonly leads to sciatic pain is by far the least common of the four. It's called spondylolisthesis, and its name is a combination of the Greek word for vertebrae and slipperiness, which gives you a good idea of exactly what it is. Lumbar spondylolisthesis occurs when one vertebra of the lower back slips forward and over an adjacent vertebra, thereby compressing the surrounding nerves and causing pain, numbness, and tingling in the back and down through the legs. Despite the fact that many classify spondylolisthesis as being the one among the four causes least likely to be treatable with exercise and stretches, 80% of all those who suffer from spondylolisthesis are able to eliminate their pain without surgery. Now, some who suffer with spondylolisthesis will actually experience a slipping feeling in their lower back as they stand up or sit up. And older adults will sometimes experience both spondylolisthesis and spinal stenosis concurrently at the same time. This is a good indication that long-term muscle imbalances have damaged tissues throughout the lower back. Because the pain associated with spondylolisthesis comes from the inflammation of soft tissues, bed rest may relieve the initial pain. However, this is only delaying the inevitable return of your pain. The sooner you begin using exercise and stretches to correct the muscle imbalances that are actually causing the wear and tear, the sooner you'll experience real relief. Diagnosing your sciatica. Alright, it's now time to identify which of the 4 disorders that we've just covered is the likely cause of your sciatica. There are a couple of crucial things I need to mention about this process before we get started. First, this part of the program is necessary because identifying the likely cause of your sciatic pain will help you to find a way to quickly relieve it. In fact, the second part of our program, Immediate and Extended Relief, groups the pain relief methods that we recommend according to the cause you will identify in just a moment. Now, the second thing is this. Even if you are still unsure of which of the disorders you have when you come to the end of this part of our program, you need to know that you can still get both immediate and long-term relief from the natural sciatica relief system. Not only are there a number of immediate relief methods which will work for nearly everyone with lower back pain, but we also know that the most universal cause of back pain is muscle imbalances, which we will learn to identify and correct in the final 2 parts of our program, ensuring that you will experience long-term pain relief regardless of your diagnosis. Now, be sure to have your workbook close at hand throughout this process so that you can record your findings. You should also have completed the preliminary assessment at the beginning of your workbook before you go any further. Now, because identifying the presence of these 4 disorders will require some stretching and mild exercise, you'll want to warm your body up before you begin. A hot shower or just a few hours of normal activity after waking up should be sufficient. Remember also that we all have different limits, so you need to progress at a pace that's right for your body. If you're unused to the activities in this or any part of our program, add them to your routine slowly. Now, I know that you're excited to relieve your pain and correct your muscle imbalances, but if you're too aggressive, you will actually lower your chances of success. After every new addition to your routine, give your body a day or 2 to react. And if your pain increases, you may not be ready to add that exercise just yet. Identifying piriformis syndrome. For each of the 4 common causes of sciatica, we're going to share with you both the environmental factors and symptoms typically associated with the disorder and a physical method of diagnosis. Since you have already heard each disorder described, you probably have a good idea of when you should follow along with our demonstrations and when to simply listen closely. We'll begin with piriformis syndrome, the most common culprit in causing sciatic pain. Remember that piriformis syndrome occurs anytime the piriformis muscle irritates the sciatic nerve, and that both a sedentary and a highly active lifestyle can lead to piriformis syndrome. Now, anyone who spends many hours every day sitting, whether at their desk or in the car, is contracting their piriformis muscle when they flop their knees apart. Any repeated activity tends to cause a muscle imbalance over time unless it's deliberately counteracted. Sitting for extended periods may eventually become painful for piriformis syndrome sufferers. Your legs may tingle or begin to go numb throughout the day, forcing you to stand up and walk around the room to relieve the irritation. Someone with piriformis syndrome may experience pain, numbness, or tingling down one or both legs, beginning in the lower back and radiating down the thigh and sometimes all the way to the calf. These symptoms will be most likely to occur after you have been sitting for an extended period of time or after performing lower body exercise, even something as simple as climbing a flight of stairs. If you can tell your pain comes from an employment of your hip flexors rather than your lower back, you may be suffering from piriformis syndrome. You may also experience sciatic pain originating from your hip muscles if you have strained or overworked them while exercising or performing some unusual task like shoveling snow or moving boxes around an attic. Here are 2 quick tests you can do that will indicate if you have an overly tense piriformis muscle. First, lie down on your back with your nose and your toes facing the ceiling. Make sure your legs are naturally spaced, but keep your heels planted. Now, take a couple deep breaths and relax your entire body. Slowly lift up your head and take a look at your toes. Where are they pointed now that they're relaxed? People who suffer from piriformis syndrome will notice that their toes are pointed more toward the floor than the ceiling, at perhaps a 45-degree angle or even more. You may also notice that one foot departed further from the 90-degree angle than the other. This is a good indication that your piriformis muscle on that side is more tense. Many times, a simple pressure test can be used to identify irritation of the piriformis. First, we need to locate the muscle, which, as we said before, has its origin on the sacrum and the pelvis. You can perform this test on your own or with the help of a partner. Reach around your back and find the tip of your sacrum at the bottom of your back. You should be able to roughly feel the triangular sacrum. Now, feel for the hip bones, not the crest of the pelvis, on the outer edge of the femurs. Then simply draw an imaginary line from the midpoint of the sloping sides of the sacrum to the hips. You have now located the piriformis muscle. Simply put a bit of pressure midway between these 2 points for 30 seconds to 1 minute. If by putting pressure on the piriformis for this short period of time, you can begin to induce the back and leg pain that has been causing you problems, then you have identified piriformis syndrome as the cause. Remember, it is very possible that you simultaneously suffer from more than one of the 4 common causes of sciatica, so be sure to keep watching attentively to the end of this program. Identifying a bulging or herniated disc. The second most common cause of sciatic pain is a bulging or herniated disc. Remember that though this disorder has many names, the common cause is muscle imbalances rather than sudden trauma. While your pain may have begun after a specific strain, a sneeze or shoveling snow or moving a box, that action was only the proverbial straw that broke the camel's back. The real cause of a bulging or herniated disc is a muscle imbalance. A healthy human body with well-balanced back and hip muscles should be able to lift a significant portion of their body weight without resorting to lifting with your legs or otherwise babying your back. Even if you suffer from significant bulging or herniation, stretches and exercises can relieve the pain for good, even after just a short time. The pain of a bulging or herniated disc is the result of the intervertebral disc being displaced and putting pressure on the surrounding nerves. This pain is most often described as deep and sharp, and is typically felt on one side of the lower back. Because the disc frequently puts pressure on the sciatic nerve, you may feel pain radiating down the leg on the same side as the herniation. Those suffering with a bulging or herniated disc also typically experience a perceived loss in the range of motion in their torso, including an inability to lean forward or back, or a tendency to list to one side when asked to lean forward. There are a couple quick ways to determine if you are suffering from a bulging or herniated disc. This first test will demand help from a partner. Lie down on your back with your legs straight and your hands at your sides. Flexion, that is a forward curvature of your spine, may increase your pain, so get into this position in the way that is the least painful for you. Once you are in the supine position, have your partner take by the heel the leg in which you have felt referred pain, or the leg on the side of your body in which your pain is the most acute. Relax your leg and let your partner do all the work. Heel in hand, they should raise the leg slowly, stopping when you let them know that you're experiencing pain or when they begin to feel the resistance that indicates that you are feeling a stretch. If you experience sciatic pain before your leg has been lifted to a 70-degree angle and after about a 30-degree angle, this is a good indicator that your pain is caused by a bulging or herniated disc. A second, more general test is to measure your pain before and after activities that result in spinal decompression. If either of these decompression methods provides significant immediate relief to your symptoms, this points to a herniated or bulging disc. We'll show you two ways to perform a decompression exercise at home. One with an exercise ball and one that you can do without any equipment at all. Lie face down with your chest on the ball and with your feet wide for balance. Slowly move forward until the ball is in front of your hips. Allow your spine to round out over the ball using your arms for balance. Relax your upper body and feel the stretch in your back. Hold this position for as long as it's comfortable and then ease out of the stretch as slowly as you need to. This second stretch can be done without a partner or any equipment. Simply stand comfortably and put your arms up over your head with your biceps next to your ears. Tilt your pelvis forward by bending your knees just a little. This will ensure that you stretch your back rather than your legs. Now, keeping your pelvis in one place, take a deep breath and slowly bend your upper body forward, beginning with your neck and moving vertebra by vertebra down your back. You may feel a bit of compression on your lungs, but unless you feel your back pain increase, continue to bend until you reach the lowest vertebra. Hold this stretch for just a moment and then reverse the stretch until you're standing straight up again. Repeat this stretch up to 10 times or until it's no longer comfortable. Again, if these decompression exercises provide you with significant, almost immediate relief, you may have discovered that the root of your sciatic pain is a bulging or herniated disc. Identifying spinal stenosis. If you did not identify strongly with the symptoms experienced by those with either piriformis syndrome or a bulging or herniated disc, you may be part of a small percentage of sciatica sufferers whose pain is caused by spinal stenosis or spondylolisthesis. Spinal stenosis is a narrowing of the spinal canal which puts pressure on nerves as they run through or exit the spinal column. Spinal stenosis may cause you to experience sciatic pain, tingling, weakness, or numbness in both legs rather than just on one side or the other. You can eliminate the pain by reducing any unnatural curvature of your spine. Most people with spinal stenosis related pain say that their pain increases while standing and becomes even worse when the spine is hyperextended, that is, bent backwards. On the other hand, their symptoms decrease when sitting or bending over. A common way to diagnose spinal stenosis is what is known as the shopping cart test. Find a counter or other stationary surface at least as high as your waist. Bend at your waist to put your hands on the counter and then arch your back. If this activity significantly eases your pain, spinal stenosis may be the cause. As a side note, because this specific posture works so well to ease the pain of an individual with spinal stenosis, consider getting your daily aerobic exercise by cycling. A stationary bike will give you the relief and exercise you need without causing additional trauma as you bump down the road. Identifying spondylolisthesis. The least common cause of sciatic pain is spondylolisthesis, the slipping of the vertebrae which we talked about earlier. It occurs when small stress fractures result in one vertebra slipping forward over the one below it, putting pressure on the surrounding nerves. This condition often occurs in children and young adults, but symptoms seldom manifest before the teenage growth spurt, and in most cases not until middle age. Spondylolisthesis can make standing and walking both quite painful, causing the sufferer to alter his gait to ease the pain. If you have spondylolisthesis, you may even feel a slipping sensation in your back when moving into an upright position. Sneezing and coughing often intensify the pain. Many who suffer from spondylolisthesis experience an unusual tightness in their hamstrings, further contributing to an unnatural gait or a waddle. It may also be painful for you to bend backwards, as when stretching in the morning. If you didn't attempt the straight leg raise test when we talked about bulging and herniated discs, try it now. Lie on your back with your legs and arms straight. Allow a partner to grasp your heel and slowly raise your leg. If you are unable to raise your leg to even 30 degrees without experiencing pain, then the tightness in your hamstrings may point to spondylolisthesis as the cause of your sciatica. Using the rest of our program. Now that you've determined which of the 4 common causes of sciatica is the source of your pain, you're ready to move on to the next step of our program, immediate and extended relief. Remember that regardless of which of the 4 causes you most identified with, you will be able to get some very real short-term relief from the stretches and exercises we have for you on the next DVD. We're also sure that we can keep your symptoms at bay for good once you use the third part of our program, Complete Sciatica Control, to correct the muscle imbalances that are the underlying cause of almost every instance of sciatic pain. When you begin part 2 of our program on the next disc for the first time, be sure to watch both the introduction and the short section entitled Bridges to Relief. After that, simply select the section relevant to your condition and you'll be on your way to managing your pain permanently. Remember to be patient and know that even if the stretches and exercises on Disc 2 completely relieve your symptoms, you need to continue the natural sciatica relief process by using the second half of Disc 2 to diagnose your muscle imbalances and the stretches and exercises on Disc 3 to correct those imbalances for good. Otherwise, I can almost guarantee that your pain will return. Thank you for making the choice to take control of your sciatic pain. We wish you the best of success on your new journey to pain-free living.